us proclaim the good news.
The SMA fathers and the Ola sisters in Ghana joyfully invite the general public to the launch of their Triple Jubilee celebrations on the occasion of the 150 years of the foundation of Ola sisters, 170 years of the foundation of SMA fathers, and 200 years of the birth of Father Augustine Plunk, founder of the Ola sisters and co-founder of the SMA fathers. The event is on Friday, the 25th of July, 2025 at St. Joseph Minor Basilica, Elmina. The time is 9:30 a.m. Come and celebrate with us as we mark a journey of mission, service, and faith. The event is on the theme, Together, Let Us Proclaim the Good News. Come and share in a day of gratitude, thanksgiving, and joyful celebration of faith. Join us in a day of thanksgiving, fellowship, and joyful witness. Together, let us proclaim the good news. Don't miss this moment of grace and celebration. Elmina awaits you.
Together, let us proclaim the good news.
Good evening and welcome to Cafdil Healthcare on Cafdil Television. We are live on Facebook, Cafdil Cape Coast, and also on YouTube, Cafdil EDU. Tonight on our show, we are going to discuss H1N1. You remember in 2009, we had a pandemic, that is a swine flu. I don't know whether you were born. And those who were born in 2009 downwards, I don't think they may have had this swine flu, and it seems we've not been talking about nowadays, but we don't have to sit down for us to catch this flu before we talk about it. Tonight we're going to know what exactly is H1N1, what causes it, and what can we do to prevent ourselves from catching this flu. My name is Kojo Arthur. Tonight I'm here with Mr. Charles Bonnie Gatti. He is the head of Disease Control Unit, KEA Municipal Health Directorate, Elmina. I'll go for a short break. When I come back, we'll start talking. Stay tuned.
Together, let us proclaim the good news.
The SMA fathers and the Ola sisters in Ghana joyfully invite the general public to the launch of their Triple Jubilee celebrations on the occasion of the 150 years of the foundation of Ola sisters, 170 years of the foundation of SMA fathers, and 200 years of the birth of Father Augustine Plunk, founder of the Ola sisters and co-founder of the SMA fathers. The event is on Friday, the 25th of July, 2025 at St. Joseph Minor Basilica, Elmina. The time is 9:30 a.m. Come and celebrate with us as we mark a journey of mission, service, and faith. The event is on the theme, Together, Let Us Proclaim the Good News. Come and share in a day of gratitude, thanksgiving, and joyful celebration of faith. Join us in a day of thanksgiving, fellowship, and joyful witness. Together, let us proclaim the good news. Don't miss this moment of grace and celebration. Elmina awaits you.
Together, let us proclaim the good news.
Welcome back. This is Cafdil Healthcare on Cafdil Television. Like I said, we are going to talk about H1N1, also known as swine flu. And I don't know whether you have heard it. If you haven't, then you have to pay very good attention. Go to your TV and let's discuss it so you don't catch it. Mr. Bonnie,
Yes, sir.
You're welcome.
Thank you very much.
This H1N1, we had it in 2009. It was a pandemic. And, well, some even died out of this. And today, we've been hearing some, rumors in the country. But like I said, we don't have to sit down for it to spread before we come and talk about it. So when we talk about H1N1, what exactly is it? And how is it different from the common flu that we do catch?
Well, thank you very much. Greetings to all viewers. H1N1 is a viral infection. And the virus, you mentioned common cold. Common cold have a lot of viruses that causes that condition. So today you may have a common cold and have another next week with a different virus. H1N1 is a family member of those viruses. So we can categorize it as one of the common cold with much more effect. Yes, so it is caused by a virus, and the virus enters the body through the nose, mouth, eye, ears, and it's a respiratory tract infection. So it affects the lining in the nostril, the throat, and then the lungs. So the difference between the normal common cold that we have and H1N1 is the fact that H1N1 can be so severe and killed. And the other way around too is a self-limiting infection. What it means is that if you have H1N1, it can be so mild enough to go by itself in about 5 days or 7 days. But then it goes beyond that. It can be more severe, especially in people with underlying conditions and certain risk that are attached to people. And so that is the H1N1. We can call it a common cold. But just that I always say, if you are there, you are normal, and things start changing in you, you need to seek for advice. You need to seek for consultation to see whether what is worrying you can harm you or not. Yeah.
So, like I said, in 2000 it was a pandemic. So how did this H1N1 go from being a pandemic in 2009 to just another seasonal flu strain today?
Yes, pandemic, the word pandemic is just one of our terms. We have epidemic, which means outbreak. We have endemic, which means the condition is now staying with us, just like malaria. Every day we see malaria, we hear malaria. Then we have a word like pandemic. Pandemic just means that the outbreak has gone beyond international borders. And so around 1970s, 1960s, 1980s, there were outbreak of H1N1 in certain localities in the world. Now, in 2009, it spread across international borders. So WHO declared it as a pandemic, meaning that now the infection has crossed beyond international borders and it was infecting a lot of people. In fact, it affected about over 280,000 people. No, 280,000 people died. Over 280,000.
That is in Ghana? Only in
worldwide.
Worldwide.
Yes, worldwide. And so the 2009 pandemic also affected Ghana. Yes. Now, what happens is that when there is any pandemic, a lot of people are infected. In fact, most people also die. After the pandemic, then we don't actually, after the, in 2010, August, that was when WHO declared H1N1 as not pandemic anymore. But then after that, you realize that there will be pockets, outbreaks in local countries. And so when that happens, after pandemic, usually the infection becomes seasonal. Most of the times when we hear that it's no more an emergency, we think that it is gone. But it will be hiding somewhere, once in a while you see it coming up. That is why H1N1 was a pandemic in 2009, and now you don't see it as a pandemic anymore, but you hear that it has occurred somewhere. It has occurred this year. I think there was a rumor that there was a school.
Yes, I was even going to ask you that.
Yes, there was a school, a second cycle institution where people were having flu-like symptoms. Certain numbers of samples were taken, and 21 of them were positive H1N1. It means that once we've heard of it, we don't have to sit down, like you said from the beginning, for it to come here. You know, in the public health sector, we alert each other. So when there is an outbreak somewhere, the Director General will send alert around for people to, for others to tighten their disease surveillance system, so that we can immediately recognize when there's any outbreak occurring and be able to contain it. The containment is what is very important. Like I've been saying, we are not surprised with the public health disease control. We are not surprised that there are infections. Our aim is to see it early and then be able to contain it so that it doesn't spread to a lot of people.
All right, so what are the early symptoms of H1N1 that people should watch out for?
Yes, so it has the symptoms of common cold. You know, when you have cold, catarrh, the one we call catarrh, most of the times there's no fever. Other times there's fever, and the fever starts from the head. You see your head will be warm, but the rest of the body will be normal. Other times the fever can descend to the rest of the body. But then you have headache, you have sore throat, you can cough, you can have, because it's a lung infection, you can have chest pain. You also have pains in your muscles and joints. You get tired easily. When you start to work, you realize that you are tired. And then sometimes you can see signs of dehydration. Signs of dehydration, you will feel thirsty always. Sometimes your eye will be sunken. And other times you realize that you don't even feel to urinate at all, because the body will shut urine production because you are dehydrated. And others, it's common cold. You know, some people may have running nose. H1N1 can get you a conjunctivitis. Your eyes will be red and painful. It can also emit fluid, your eyes. And then others.
Is it fluid that we do see them in the morning if you have an eye problem?
No, your eyes will be tearing.
Tearing?
Tears, yes. Oh, okay. Tear like something, but you see it coming. And then because it's the respiratory tract infection, and you know, sometimes when the phlegm that comes from our respiratory tract, we pop them up and swallow. It can also give you abdominal symptoms like diarrhea. It can give you nausea and sometimes vomiting. But then these are the common signs that we will see. It can be complicated. I said from the beginning that H1N1 is self-limiting, and then if your immunity does not able to take care of it, it will progress. So it can be more complicated because it's a lung infection and there's chest pain. You can have sore throat. You can have seizure at a point in time, and so many. You can, in fact, the complications are many, and it depends on your immunity. The risk factors that we'll talk about in H1N1, the line of immunity, we'll talk about children, the elderly, pregnant women, and then occupation. Like we health workers, we are frontline, especially nurses. If you come to the hospital, the first people you meet will be the nurse. Before the nurse will ask you what is wrong with you, if there's any infection, the nurse can be
distributed already.
Exactly. And then those who have underlying conditions, asthma, high blood pressure, and the others are also prone more. Those people may have much more complicated symptoms as compared to others.
But all those symptoms are very common that we do get them.
Yes, they are common. That's why we call them common cold. They are common. And the H1N1 is self-limiting. Self-limiting is that it will come, it will go by itself. But then when you are a risk, a vulnerable group, the probability of you having more complicated signs and symptoms will be there. So even if you are not a vulnerable group and you have common cold 1 week, that is 7 days, 2 weeks, you should seek for attention.
So then how long does the H1N1 typically stay active in the body, and when is someone most contagious?
Well, first, when the virus come in contact with you, it will take you 1 to 4 days for you to show the infection, to manifest the disease. That is, to show signs and symptoms of the disease. But when you get the infection, a day before the day you show signs and symptoms, up to 4 days, you will be emitting, you can be transmitting the infection. And then if there is runny nose, and it will contain the virus. And so once you spread your nose product, the nose cells, that is the time when the virus is active to pass on to the others. But most contagious is a day before the manifestation of signs and symptoms, up to 4 days.
Then it's serious. So typically, what does H1N1 look like from diagnosis up to recovery?
H1N1 before diagnosis, common cold. It's common cold. So typically how it looks like is you showing signs and symptoms of common cold: headache, nostril blockage, nostril dripping, and chest pain, sore throat. But then after it has been diagnosed, then we need to let you know this type of common cold that you have is more contagious as compared to others. So you need to take care of yourself. You need to take your medications. Somebody was asking whether we will isolate you. We don't actually isolate H1N1 cases, but then it will be advisable for you to keep away from people a little. In fact, you staying away can even help your own self to heal. So that common cold, you can have one cold today and you meet another person with another common cold, different virus, and you can contract it. So you'll be having double. So it is better you stay away a little, but strictly we don't confine people because they have H1N1.
In 2009, were people isolated?
No. 2009, nobody was isolated.
Because it's contagious just like COVID was also contagious.
Yes. I was telling someone that the contagiousness of a disease does not only depend on the infection moving from me to you. It also depends on how you can handle it, you the receiver, how the ability of the infectious agent to thrive in you also depends on it. So it can be that it can pass to you easily, but how can it thrive in the susceptible host is also considered. COVID, when it comes to you, it's very easy for you to manifest signs and symptoms. It's not the same as H1N1. You've
already said it concerning the outbreak. Is it in Accra or Kumasi or where?
I think it's in Kumasi. Either Kumasi or Accra. I don't quite remember, but it has been contained. That is the most important thing. You know, I'm always giving example with COVID. Not long ago, we heard from University of Ghana that there were about 117 people were tested positive for COVID. That's it. It has been contained within it where it was found. It didn't go out of the school. So that is our main work. Immediately we see we suspect, we diagnose, we isolate, and then we follow contacts. That's what we call contact tracing, so that we make sure that if you are a contact of this case, we limit your movement or we monitor you, so that even if you show signs, you don't also pass it to another person. Because of the fact that before you will feel ill and come to us for diagnosis, you might have spread the infection already. That's why we trace those who have come closer to you, so that we can monitor them. And as we are monitoring those we count people who are infected that are contact of cases. Yes, so we know that if you had gotten the infection because you were close to me, there's a possibility that somebody was also close to you before we even, like I said, H1N1, if I show signs today, if I start getting common cold today, by yesterday, if somebody came closer to me, the person might have gotten the virus, not the infection, the virus. And so the person has 1 to 4 days to also manifest the infection.
Okay. In fact, spreading of disease is not easy, especially the contact tracing.
Yeah.
Which you have to. I'm closer to you. You've given it to me. Somebody closer to me.
Yes.
Somebody may also be closer to the one closer to me. Then
closer, and there is in chain. This is more clear, especially in HIV. You get it. It's more the chain of infection is more clear. If you allow me, I can talk a little about it.
Go ahead.
In HIV, 2 people coming together, sexual partners. Let's say one of them is married, the other one is a concubine, a side chick or side guy, and the person, because this person knows that this person is married and permanent somewhere, you cannot be married, and so you also have other contacts. Other contacts also have their contacts. Sometimes casual sex, permanent sexual partners, and so these 2 people meet, these 2 people will meet other 2, and then they keep meeting.
So that one there goes 2.
It goes 2. Now it's even more than 2. People are having threesome and other things. Now it is even more than 2. And the issue is that you will not even think about it till one of them is in trouble. So you come, we test you are HIV positive, and then we start asking for your sexual partners. And then if you can remember them, you go and tell them, I went to test and I was positive. So you start crying small, then you go and test. If you are negative, thank God. If you are positive, you also try to locate your contact. So that's how
contract is a very huge job.
Very, very much.
Very huge job anyway. It's not easy. Also, so you've already said a bit about the transmission. I want you to reiterate that, and how is the H1N1 transmitted, and is it more contagious than the other flu?
Yes, as compared to the other common flus, H1N1 is more contagious. And then how it transmitted, for every infection, we call it portal of entry and portal of exit. We have a place where the infection can pass into you. And so if I go and fetch HIV blood and smear on my body, if there's no cut on the body, nothing will happen. I can eat HIV virus. If there's no abrasions in nothing will happen. They will even be digested, unless a place where there are plenty that they can diffuse into the blood system. But when we talk about H1N1, it's a respiratory tract infection, and so it can enter into a portal that has link into the respiratory tract infection. We call ENT, ear, nose and throat. And so the ear, nose, and the throat, and even the eye are linked together. They all drain in the throat. And so if you have the virus, if I have the virus H1N1, as I'm talking, as I am trying to clean my nose because my nose is dripping, as I'm trying to decongest my nose by blowing and other things, the viruses will be emitted. It's also a droplet infection, just like COVID. And so if it gets into you, if it fall on your hand and it doesn't go close to your face to enter, you are safe. And so if it comes to your face, it can enter through your nose, your mouth, your eye, your ears. And so apart from that, as I'm talking, if the virus are emitted onto this table and you come and you touch your face, you can get it. If any other surface is contaminated, you touch it. If I do nose picking and I use my pen, you come and use it, and the virus is on the pen, and then you touch your face, you can have it. So this one, the difference is that if the virus is on you and you don't go to your face, you are safe. But if you touch your face or any other contaminated thing goes to your face, and the virus enters through your nose, through your mouth, your eyes, your ears, then you can have the infection. And so after it has entered, it doesn't mean that you have the infection. Sometimes you can be exposed to the causative agent, all right, but you will not be showing any sign and symptoms. Yes, but after the virus has entered in you, you have the day that the virus entered up to 4 days or even more. But the standard is 1 to 4 days to show signs and symptoms. So this one is not like I soiled my hand with nostril, I shake your hand and you have it. No, your hand has to go to your face. And so if you are a person who likes using hand sanitizer, you will be safe a little. If you are a person who likes washing your hands with soap and water, you are also safe. And washing your hands is not only with water. For example, COVID, they have a fatty coat. The COVID virus have a fatty coat that can be dissolved with soap. And so if you wash with soap, it's more advantageous. If you just rinse your hand, you are just wasting the water as far as those infections are concerned.
But can someone have H1N1 and not know it?
You can have H1N1 and not know it because, one, you may have the virus and it has not shown any sign and symptoms. And so as far as you are concerned, you are okay. And then the other way around, you would have common cold. And that will not be the first time you are having common cold. You've had it several times. Now you have H1N1, which is manifesting as common cold, and you will think it's common cold. Sometimes you have common cold before, and now you have this. You say, this time my common cold is very severe. In fact, it is worrying me. It might be more than common cold. Yeah. So of course, nobody gets common cold and go to the hospital unless it is severe. That's why I'm saying that once it's a self-limiting infection, we'll give ourselves from the day you manifest infection up to 7 days. If it is still worrying you, don't sit on it. You have to seek for advice.
So we have so many seasonal flu vaccine, available. And so I want to know, is the current one that we have, the seasonal flu vaccine that we have, effective against H1N1? The only seasonal flu vaccine that we have is the H1N1. Because of the outbreak in 2009, that brought that vaccine. We didn't have vaccine for common cold or flu till the outbreak of the H1N1. And so now that's what we have. And when you give the H1N1 vaccine, it affects about 4 to 5 flu viruses. Yes, so it all depends about the nature of the virus. Viruses are in families. And so families have certain similarities in DNA and other things. And so if you are closer in similarity to the H1N1, the vaccine can also affect you. But it is established that the vaccine is effective apart from H1N1. It is effective against about
4 to 5 flu viruses.
If you just tune in, this is Cafdil Healthcare on Cafdil Television, and we are discussing H1N1, also known as swine flu. And I have with me Mr. Gatti, who is doing justice to all our questions. And we are live also on YouTube and also on Facebook. Facebook is Cafdil Cape Coast and YouTube Cafdil EDU. Subscribe to our channel so you can get all our show and follow us as well. Who should get the flu vaccine, and when is it the best time to do it?
Okay. to answer this question, I would like you to know that there are certain vaccines that we don't keep stock. We only have stock when there is an emergency to attend to. And so it's not like we have the flu vaccines in stock that we can call people, if you want, you can come. But then it happens that there is an outbreak, or there is an impending outbreak or suspected outbreak. We have how we measure. We have thresholds, outbreak thresholds, those things. So when it happens that there is vaccination to be done, everybody is supposed to take the vaccination, except when the vaccines are not enough or they come in bits. So we protect the vulnerable first before we get to the general public. And so in this case, the frontline health workers will be are supposed to be vaccinated. When we are from them, the security are also prone to outbreaks, and so we also protect them. And then in the general public, we will select people who have underlying conditions. If you have asthma and you get H1N1, it will be worsened. If you have hypertension, diabetes, when you have diabetes, your immunity is compromised. Hypertension, even people with body mass index 40 and above, obese people, your immunity is somehow not normal. And so those people, and then the aged will also be vaccinated. And so when the vaccines are not for enough to cover everybody, by all means, some will come later, but we will vaccinate the vulnerable groups first before we get.
You made mention of frontliners, nurses, doctors. What about teachers?
Teachers
are they not also frontliners, especially with this the H1N1, because it's among the children.
You are going to spark a debate. Teachers have contact with population, but we are talking about if you are sick, where will you be? If you are sick, you are going to the health facility. So the person taking care of you knows that you are sick. You know that you are sick, and you are coming to the person. In the classroom is made up of healthy people, in quotes. So teachers will come, but teachers will come after the health workers, the frontline health workers. Teachers will even come after security personnel who are at the borders. Teachers will come after the other vulnerable group, the aged, the underlying conditions and other things, because the thing is that, in quotes, the people that the teachers are facing are healthy.
That's what you presume to be healthy. You presume that those children are healthy.
I'm not presuming. You know that those people are healthy. If you are sick, we'll go to school. That's why I said you are going to spark a debate, because teachers, of course, have mentioned that because they also come in contact with the population. They are also frontliners. We are talking about frontliners of health-seeking people. You understand? People who are coming to seek help. Why do you go to the hospital? You go to the hospital because you are sick. Even if you are going to the hospital because you want to do checkup for what? It's not sickness. Yes. And so when we are talking about disease, when we talk about frontliners, we are talking about people who come in contact with sick people, notionally or reality.
But you see, when you talk about vaccines or vaccination, there's often a vaccine hesitancy and so forth. So can you explain how flu vaccines are made and why they are updated each year? Because people, you face this hesitancy because a lot of people don't know how those vaccines are made.
How many people know how paracetamol is made? how sobolo is made? It's just that vaccines are produced in this way. The causative agents, we call them antigens, the ones that bring those specific infections, we take them, we mutilate them, we either kill them or take away their ability to cause infection, and then we use part of them to produce the vaccine. And normally a vaccine to come out as approved takes not less than 2 years, except COVID, when there was an emergency and so things were done in emergent way. But then vaccines are produced in the lab to cater for specific infections. You can't say I have vaccine, it can cure measles, it can cure diarrhea. No. Vaccines are specific, and so that's how it is produced. They are updated, not that we have produced, for example, we have H1N1 virus, vaccines today, and we will update them every year. We will update vaccines when we realize that the antigen has changed its nature. Like virus, that's what they do. They are here, you handle them, the next time they come, they change their form. And so the vaccines can only be updated when we change the viruses change their nature. Most of the time, the change in the nature of the virus is not so much DNA. And so one of them with the same similar DNA can handle. These are biology technical things. What the public need to know is that vaccines are safe. Vaccines have helped us to control a lot of diseases. I was telling somebody the other time that in the olden days, when we were growing up, we had a lot of siblings. We had a lot of siblings. My siblings were 7. Apart from them, my stepmother had about also 7 or 8. We asked, and what they said was they produce more children to help in the family business, farming, fishing. Was that the truth? The truth was that children died a lot. We used to know about 6 killer diseases that were killing a lot of children, and so families give birth to more children so that more, if some die, some will be left. Now, if you decide to give birth to 10 children, they will survive on your neck, because now we have vaccine preventable the disease. We have vaccines to prevent them. So measles is no more killing children. Tetanus is no more killing children. Whooping cough, pertussis. There's a condition called pertussis. Smallpox is gone. All of these things were killing a lot of children. Vaccine. It was vaccine. This COVID that we all know about so much. COVID was coming. We were so devastated. We couldn't control it. But immediately the vaccines came. That was why we were so strong in convincing people. People were insulting health workers, but we were still convincing them to take the vaccine because we knew what we were doing. The vaccine was the one that's going to limit the spread. And so vaccines save life a lot. But there are people who eat by just becoming anti-vaccine campaigners. And so they have a lot of things to say about vaccines. In Ghana here, people have children who go to weighing child welfare clinics, and they are given vaccines, and because of that, the children are alive today. It's the same people who produce those vaccines that we give to our weighing children are the same people who are bringing the vaccines that are used on adults. What is the difference now? Why are we now crying that some people somewhere want to wipe out Africans, and so they are bringing...
The vaccines are made there, and so they bring it to Africa to test. If you don't die, then they
will also use it. When the COVID vaccines came, where did they start? It was not Germany and US and UK that they started giving them before it came here. Now, that's what people say. But before any drug, including vaccine, will come out, they are tested. In fact, they do the the medication, the medicine or the drugs, they test them in animals for about a year or two before they will test them on humans. And those people that they test them, the humans that they test, it's not a random thing. They advertise in their own way. If you agree to do it, you will sign a consent form that they will tell you this is a new thing, this and this and this can happen, because when we tested them in animals, this is what we saw. And so if you agree, you sign and you'll be paid. They pay them very well. And so it's not like
so they pay you well. I'll go and test.
So it's not like they make the drugs or produce the drugs and randomly test it on people. After it has been approved by WHO that these drugs or these vaccines can be used by human beings, when it enters Ghana, the Food and Drugs Board is also here to certify that it is safe for human consumption. So after testing it on humans, you know the side effects of the vaccine or the drug in question. And so the FDA, the Food and Drugs Board, will also be looking for those things. That is why in our disease surveillance, we have something called adverse drug reaction and then adverse events following immunization. Anytime anybody takes any drug or take any vaccine and even fever, we report it. And so we'll be reporting till they look at it and see that no, this sign that you are showing were not shown in anybody during the testing, and then the drug will be investigated, and then the right things will be done. If there will be any updates, if there will be any improvement, it will be done. So any vaccine or drug that enters the country is safe.
Has there been a situation where FDA have rejected some vaccines?
Not that I know, but I know FDA has been rejecting drugs a lot. So when they test it and they see that it doesn't show what the producer or manufacturer is saying, they reject it for you to come and explain more. But for vaccines, not anyone.
All right. So if someone tests positive for H1N1, what should they do?
If you test positive, you can only test positive with us, the health service. And so if you test positive, you know, H1N1, we also treat symptoms. So if you have headache, we treat. If you have cold, nasal congestion, we treat. So if you have tested positive, you don't have to panic. All that you need to do is that every advisor will give you your medication, take them judiciously. You take in a lot of water, and then you stay calm. It's not any dangerous thing. We will not restrict you as in isolation, but you yourself, you feel okay when you isolate yourself, because you'll be sneezing, you'll be coughing, sometimes you have pains in your eyes and other things.
Oh, okay. So then when should someone go to the hospital for flu, what do you call it, symptoms?
Well, thank you. We all have flu. We've gotten flu before and we didn't go anywhere. And so if your flu is giving you chest pain, it's a dangerous sign. You need to go and see a doctor. If you have difficulty in breathing, you need to go see a doctor. In fact, if you have any underlying condition, especially asthma, and you have flu symptoms more than a week, you need to see a doctor. Yes. There are times where H1N1 has caused seizure in some patients, and so if that happens immediately, you need to see a doctor.
You see, you made mention of children, pregnant women, and so elderly and stuff. Why are those people more at risk with H1N1?
It's all about their immunity. Children's immunity are low. The elderly, the immunity is low. Pregnant women, by nature of their state, their immunity is low. And then, there are certain medications that also reduces our immunity. If you are given a medication at the hospital and it will reduce your immunity, you'll be told. And so if you are that type, your cold should not keep that long. You should report to a doctor.
So, children go to school, parents are not there, teachers are there, and so on and so forth. So I want to know, how can parents protect their children during this flu season, especially in schools? How are they going to protect their children?
Okay. Whatever the parents will do for their children, they should do same for themselves. So in preventing H1N1, we need to wash our hands often. Hand washing with soap and water. Some of our schools don't have hand washing facilities, and so it is imperative for parents to give their children hand sanitizer. My little daughter, you give hand sanitizer, 1 full bottle, and she will bring empty bottle, because she will use it and make sure that everybody in the class will also use it. It shouldn't deter us from giving them the next day. We should give them the hand sanitizer. Once they use it to clean their hands, it is good. And then they will encourage them to wash their hands very well. Even though the weather is cold, it's a season for common cold. And so, you know, when the weather is cold, we don't feel thirsty that much, but we must be drinking water. Nobody should wait till they are thirsty before they drink water. Thirst is a crisis of dehydration. If you are thirsty, it means your body has lacked enough fluid. And so every time you should be sipping water, and you realize that when you sip water, you urinate a lot. It's good. Just that during 5 p.m. and above, you should reduce it, because you'll be waking up too much to urinate. What we also do is that people go around sneezing everywhere, coughing. And so we need to cover cough etiquette. We need to cover our mouth when we are coughing. We need to cover our nose when we are sneezing, because as I am talking, bubbles are coming, air bubbles. But if I sneeze, thousands of them will pop out. And so if I'm sneezing, I have to cover my nose. And then people sneeze and they use their hands to clean and other things. It is very unhygienic behavior. And so we have to use either handkerchiefs or tissues. It is very, very important for us to use tissue, because tissue, you use it once, you wrap it and keep it. Hanky, you sneeze your nose, you come and use it again. Even if you forget, you can even use it to wipe your face when you are sweating.
That's what we've been doing.
Yes, so we actually have to have tissues, especially when we have flu symptoms. We need to have tissues. We use it once. You don't throw them in the environment. We wrap it nicely. We keep it either in our bag or somewhere that will not be exposed to people. So when we get home, it's in our bag, we can put it in the dustbin.
But are we prepared as a country, as a health workers, and so are we prepared for another flu pandemic? Could H1N1 mutate into something more dangerous again? Is it possible?
Yes, it is possible. And yes, we are prepared. You know, anytime there's an outbreak, there's something new that we find. Because causative agents always have a surprise nature. But then, due to our integrated disease surveillance and response, we are prepared. That's why I was telling you the other time that we are not surprised if there's any infection, because we are expecting. Looking at things around us, you cannot stay without suspecting that there can be outbreak or not. And so we are prepared in terms of technical know-how. We are prepared in terms of tracing contacts and containing outbreaks. What may overwhelm us may be, for example, the way COVID came so drastic, resources. And so even that, the private sector came in seriously and things were done. So technically we are prepared for any infection. What we need to do more is, like I'm doing now, talk more. Let the community members know more about these infections, and most importantly, report early so that things can be done in a very nice manner, not in emergency.
So can the flu vaccine give you the flu?
Not exactly. Sometimes because we use the part of the antigen, the causative agent, to create the vaccine, you can have mild symptoms of that disease, but it will be so mild that it will not harm you. It comes one day, mostly 3 days, it is gone.
So it can give?
It can give you flu, not that serious flu, maybe headache or little fever, and then it will pass on.
My last question, our time is up. Beside vaccination, what are some everyday habits people should adapt to avoid catching or spreading H1N1?
Okay, so for me, the first one will be improving our health-seeking behavior. We when you come to Ghana, everybody is everything. So when you are there, you know yourself, and things start changing in your body, you need to seek for medical advice. And so if people improve their health-seeking behavior, we should try to advise ourselves. You know, people will be sick, they will first call on the drugstore, the over-the-counter medication, and then you'll be overwhelmed to see the number of people that go to spiritual camps seeking for help. Of course, everybody has his own faith, but you know, once the disease you are having has manifested physically, as you are seeking for faith-based intervention, you need to come to the hospital, the health facility, so that we can also take care about the physical aspect. In fact, you have to come to the hospital before you go to the faith-based place. The other thing is that, like I said, you will be surprised that even today, people just walk about and be spitting around. People will be sneezing everywhere. We need to have cough etiquette. We need to cover our nose and mouth when we are sneezing and coughing. We need to avoid spitting around. It's not hygienic. And then, most importantly, hand washing should be part of us. We shouldn't wait till there's an infection. Hand washing should be part of us. And then also drinking water. Water is medicine. We need to drink not because we are thirsty, but drink because the body needs water.
All right, Mr. Charles Bonnie Gatti, Head of Disease Control Unit, KEA Municipal Health Directorate, Elmina. Thank you so much for coming, and thank you for watching. Thanks to all the crew. My name is Kojo. At the same time next week. Good night.
Sorba, moji mi Jésus. Together, let us proclaim the good news.
The SMA fathers and the Ola sisters in Ghana joyfully invite the general public to the launch of their Triple Jubilee celebrations on the occasion of the 150 years of the foundation of Ola sisters, 170 years of the foundation of SMA fathers, and 200 years of the birth of Father Augustine Planck, founder of the Ola sisters and co-founder of the SMA fathers. The event is on Friday, the 25th of July, 2025 at St. Joseph Minor Basilica, Elmina. The time is 9:30 a.m. Come and celebrate with us as we mark a journey of mission, service, and faith. The event is on the theme, Together, Let Us Proclaim the Good News. Come and share in a day of gratitude, thanksgiving, and joyful celebration of faith. Join us in a day of thanksgiving, fellowship, and joyful witness. Together, let us proclaim the good news. Don't miss this moment of grace and celebration. Elmina awaits you.
Together, let us proclaim the good news.